Now the classification of gram-positive cocci is in the basis to learn all the pathogenesis and the diseases which are caused by them. So the gram-positive cocci, they are basically of two types. They are staphylococci, one big group, and then they are streptococci. The classification of staphylococcus is very simple and very short. The staphylococci, they are all catalase positive, and then some of them are coagulase positive, and then we have the coagulase negative staphylococci. Now the coagulase positive staphylococcus, the most important ones for us, the undergrad students, they are the Staph aureus. So in other words, the Staphylococcus aureus is a gram-positive coccus. They are in the form of grape-like clusters on gram staining. They are catalase positive and they are coagulase positive. Then we have the coagulase negative staphylococci. There are two. The one is Staph epidermidis. The second one is Staph saprophyticus. And other very important point about them, the Staph epidermidis is novobiocin-sensitive, while the saprophyticus, it is novobiocin-resistant. So the Staph epidermidis is a gram-positive coccus. It is catalase positive, it is coagulase negative, and novobiocin-sensitive. While the saprophyticus, it is a gram-positive coccus, catalase positive, coagulase negative, and novobiocin-resistant. Although it's a bit difficult, but obviously you have to remember it. Now, their disease spectrum is extremely easy. The Staph saprophyticus, it causes urinary tract infection in females. The second most common bacteria to cause UTI in females after E. coli, and E. coli is a gram-negative rot. While Staph epidermidis, we all know it's a normal flora of our skin. However, it is protective as far as normal flora on the skin. If somehow it enters the blood, it can cause endocarditis. Now we comes to streptococci. All these streptococci, they are catalase negative. Now this is one very important thing. All the streptococci, they are catalase negative, and all the staphylococci, they are catalase positive. Now the streptococci, they can be classified in various manners. Now the first very important classification of the streptococci is on the basis of hemolysis. It's very simple, it's very easy. Alpha hemolytic, beta hemolytic, and gamma hemolytic. Alpha hemolysis is partial hemolysis. Partial hemolysis on blood agar, there is greenish discoloration. Beta hemolysis is complete hemolysis, while the gamma hemolysis is just a misnomer, means no hemolysis. Strep bovis is an example. Now the alpha hemolytic streptococci, there are two very important ones. They are the Strep viridans and the Strep pneumoniae, which is also commonly called pneumococci. Then we have the beta hemolytic streptococci. The two most important names are Strep pyogenes and Strep agalacti. The Strep A. galacti, it causes neonatal meningitis and sepsis, and Streptococcus pyogenes, it causes pharyngitis, various skin infections, rheumatic fever, and acute glomerulonephritis. Now, the beta hemolytic streptococci, they have another very important classification which is called the Lancefield classification. The Lancefield classification is based on the antigenic differences in the C carbohydrate which are present in the structure of the beta hemolytic streptococci. Now, it is a very important point that the alpha hemolytic streptococci are not in the Lancefield classification. Means C carbohydrate is not present there in the structure of the streptoviridans and the pneumococci. Only the beta hemolytic streptococci, they are classified into various groups on the basis of antigenic differences in the C carbohydrate in their structures. Now, the groups are various from A to U, but the three most important which can cause the disease in the humans, they are A, B, and D. The G ones are enterococci. The enterococci, they can cause biliary tract infection, urinary tract infection. There is also Streptococcus bovis in it. The group B are Streptococcus A. galacti, and group A is Streptococcus pyogenes. Then the Streptococcus pyogenes, they also have another very important virulence factor. Now, the C carbohydrate is also a very important virulence factor, which is M proteins. There are more than 80 types of the M proteins, and pyogenes is divided into various serotypes. And on the basis of the one of the many of these 80, the two are very important. One is nephrogenic and the other one are rheumatogenic, which can cause rheumatic fever and which can cause acute glomerulonephritis. So this is a very simple criteria of the classification of streptococci. On the basis of hemolysis, alpha, beta, and gamma. Alpha ones are streptoviridans, normal flora of the oral cavity, pneumococci, which can cause the pneumonia, otitis media, meningitis in children, in adults. Then the beta hemolytic ones, and the beta hemolytic ones are further divided into various groups on the basis of antigenic differences in C carbohydrate, and this classification is called the Lancefield classification. It's a very, very important university question. The group A, pyogenes, group B, Strep A. galacti, and the group D, enterococci. And all these streptococci, they are catalase negative.